Bay State Health in Springfield, Massachusetts incorporated the FGI Guidelines in their hospital expansion project to create what they called the Hospital of the Future.
We started the project and we had a set of guiding principles that was agreed to from the nursing staff, from a leadership point of view, from engineering and patient advisory groups, and that was our standard for what the hospital was going to be, the new building. And it involved trying to create that healing environment that involves acoustics, natural light, and a lot of other things that were going to be very important to our design process. We continued to revisit those guiding principles throughout the process. Once we have contractors on, our engineers, everyone bought into that document as something that would lead us to what we've gotten as a building.
The design is very decentralized. We have very purposefully designed on-stage areas where the care team interacts with patients and families, and then an off-stage area where all the support functions are that supports care, like utility rooms and kitchens and med rooms. In old nursing units, they were always part of the patient care area. In our new design, our objective was to keep the areas very quiet and healing for our patients and families.
In addition to having private rooms now, in the past, we were always afraid to close the doors. So now we actually, unless the patient specifically asks for the doors to be open, they can be closed. There's a glass panel in the door. So just closing the door obviously improves the quietness in and of itself. We're able to do that partly because of the angled walls, because the line of sight to the nursing station through the glass in the door to the patient is there. Also that on-stage, off-stage idea. So food, linen, any other deliveries come in a central core that isn't exposed. So we minimize the amount of carts that are being pushed down the corridors. At night for evening hours, we actually have sort of quiet hours where we actually dim the lights to sort of visually show that it's kind of like at a library, you sort of react naturally to, oh, I better sort of lower my voice. It's not easy though. I mean, you think about the caregivers, they're here trying to do very, very important work for our patients, and they want to communicate effectively, they're very serious. They're not sort of thinking this is off hours, I'm just here just in case something happens. They have a very specific job to do. It could be checking vital signs, it could be monitoring the patients, it could be just communicating with fellow staff in the hallway. So it's not natural, but it's important that folks pay attention to quiet. One of the other things you may have noticed about the new rooms was the walls are not orthogonal or perpendicular. They're actually at an angle, and they allow the patient's headboard and bed to be sort of facing towards the window so they can feel the warmth of the sunlight on their face while they're recovering. They can also see the natural light as opposed to just watching a TV or reading a newspaper. They can actually see outside, which has been very, very well received. The idea of building a non-perpendicular wall, though, created quite some controversy early on in the project. The folks that would normally have the most problem, like myself, about does that add costs, sort of got over it because we thought the benefits would outweigh it, but even some of the clinicians became sort of nervous at first, and we had a much more dialogue than I thought, but it turned out really well. Right now it's proven to be a great idea, and we're replicating it in a future phase, so it worked out so far.
So we know that quiet is important, we know that sunlight is important, we know that acoustics are important, so the rooms are built to be extremely quiet.
The acoustics and the ability for a patient to rest is very, very important as part of their recovery, and for us to sort of have these quiet hours and do everything we can to maintain a quiet environment is extremely important to the patient.
We took our guiding principles that we developed as a team and with our leadership group and work with our architects and design team to incorporate the FGI guidelines and our DPH guidelines, which are entwined with those FGI guidelines, and bring them to bear on the guiding principles so that the ultimate design would incorporate all of those components.
So we're very confident that what we've built in the Hospital of the Future has impacted the patient experience significantly. We know that because we talk to our patients real time when they're here in the hospital. We also see the result in our HCAHPS scores, and we have seen a direct incline from before we moved into 2 years post. And that includes the noise level, that includes our cleanliness, and our overall satisfaction with our experience in the Hospital of the Future.
So we felt that not only creating a great environment for the patient was important, but to provide a great environment for the staff that takes care of those patients was equally as important. And we played that through in our guiding principles throughout.
Initially, it was kind of a shock, culture shock to people because it was so quiet. We're used to the monitors, we're used to phones, we're used to everything going off. And now with everything going to our phones and having alarm management, it's been really nice. We can focus a little bit more. We don't have so much alarm fatigue. patients can rest and recover in a nice quiet area. So it's been a great thing for the patients.
So we're here for one reason, and that's to provide exceptional care to the patients in our community. And that's our mission, and we take that very seriously. And what the Hospital of the Future has allowed us to do is to deliver exceptional care in an exceptional environment. And that provides the patient with an exceptional experience. And that's why we're here every day.